Hello and Minglaba. Happy Myanmar New Year, everyone. Welcome to Myanmar Radio's Myanmar Today. I'm Henry Zin. COVID-19 outbreak in Myanmar and monasteries to self-quarantine to limit the spread of the virus. Myanmar reports a rise in the total number of COVID-19 cases to 85. For the sake of the convenience of people, convenience stores to remain open during Thingyan holidays. And a story coverage on China grappling with growing asymptomatic cases. All of that on this edition of Myanmar Today, but for now, let's take a look at what's happening in local news. State Councillor Aung San Suu Kyi, who's also the chairperson of the National Central Committee for COVID-19 Prevention, Control and Treatment, said in her video conference call from the presidential palace in Naypyidaw with the persons battling on the front lines against the pandemic in Mon State on Wednesday that people are the key in the struggle against COVID-19. The State Councillor held discussions with Ubobo Win from the Civil Society Networks in Mon State, Dr. Wim Mon, Deputy Head of the Mon State Health Department, and U Deng Tai, the Administrator of Sechio Ward in Molamian Township. In response to the discussions, the State Councillor emphasized observance of directives and rules, the importance of awareness campaigns, and the government's possible assistance. She also gave a wide range of advice on collaboration among the administrative sector, health workers and volunteers, participation of individuals and following healthy practices. The State Councillor reiterated the importance of hand washing frequently, wearing face masks, getting official news on the disease and the pivotal role of the people to prevent the disease from spreading. In conclusion, she praised the works of frontline workers and volunteers in combating the COVID-19 virus. Union Minister for Social Welfare, Relief and Resettlement, Dr. Win Myat-A, held a coordination meeting to continue implementing processes concerning COVID-19 in IDP camps on Wednesday. The Union Minister said the Ministry of Office of Union Government, Ministry of Health and Sports, Ministry of Social Welfare, Relief and Resettlement, and state or regional governments are working together for protection, containment and treatment concerning COVID-19 in IDP camps across Kachin, Rakhine, Shan, Kayin and Chin states. He said they have notified management committees and residents of IDP camps of what procedures to follow concerning COVID-19. Director General Dr. Koko Nain of Disaster Management Department said they installed hand-washing basins and distributed soaps and masks in 6 IDP camps within Mijina Township, Kachin State, on Wednesday, 2 IDP camps in Limeware Township, Kayin State, soaps to 7 IDP camps in Palawat Township, Chin State, 5 monasteries in Sitwe Township, Rakhine State, and IDP camps in Kutkai, Namtu, and Namkan Townships, Shan State. Mandalay City Development Committee will enforce wearing face masks with imposing fines commencing this Friday. A member of MCDC, Ucho Sammien, said their committee, the representatives of markets, textile merchants, and well-wishers will distribute reusable face masks to the public in the city. The officer said, quote, "Everybody is at risk of this disease. Nobody should be careless about it and need to follow the instructions of the Ministry of Health and Sports in protecting the respective communities and the country." The local representatives, local authorities and volunteers are conducting awareness campaigns for wearing face masks at present and banning those without face masks from entering the markets. The Department of Rural Development and the UNICEF has set up 3,520 hand wash basins out of the planned 3,926 units in 2,798 villages of 162 townships in Myanmar. The State Department and the UN agency have put hand wash basins into places of public areas such as village markets, religious sites, healthcare centers, and bus terminals, in addition to distributing awareness posters, supplying water and hand wash soaps, and maintaining these materials. That's all with the local news. Let's take a look at the first report now. The wave of COVID-19 infection has unfortunately touched Myanmar this year, and hopes of holding almost all traditional celebrations marking Thingyan have faded away. The monasteries and meditation camps are not available for religious reasons, as the government has ordered the public to stay at home and avoid public gathering during the annual Thingyan festival to limit the spread of the disease.
Despite a modern Thingyan, pouring holy water on pagodas and stupas, keeping Sabbath at monasteries, young people performing hair washing of the elderly in traditional manner, and taking part in water festival by gently and politely splashing water on each other are some of their practices during Thingyan, a period of changing from one state to another, along with the New Year of Myanmar. Moreover, young people perform community nail cutting of the elderly and pay homage to the older generation. Ladies sweep the terrace of the pagodas and compounds of the monasteries in belief that it would help clear away their bad lucks of the old year and it would welcome in the new year. But this year, unfortunately, the wave of COVID-19 infection has touched Myanmar, and hopes of holding almost all traditional celebrations marking Thingyan have faded away. The monastery and meditation camps are not available for religious reasons, as the government has ordered the public to stay at home and avoid public gathering during the annual Thingyan festival to limit the spread of the disease. Presiding Sayaro Badana Tumana Damikarama Pagantaite said.
ခါတိုင်းနှစ်ဒီမှာတော့ဘုန်းကြီးတို့ကြောက်မှာတော့ဒုံလဘတွေအမြဲတမ်းများပါတယ်ကိုယ်နေလည်းများတယ်ရဟန်းနေလည်းများတယ်150အနည်းဆုံးဝန်းကျင်လောက်ရှိပါတယ်
Every year, the people wishing to enter a temporary monkhood come into my monastery are quite many. The number of novices and temporary monks is also several, with minimum number of 150 to 200. Some have entered temporary monkhood since the start of the closure of the schools. The donation ceremonies are also many, and they start 2 or 3 days before Thingyan. During Thingyan days, we lead a recitation of the precepts to be taken by laypersons at our monastery every day. There are more than 100 yogis. This means those who practice religious meditation. Moreover, there are almost 300 yogis taking the recitation of the precepts. This year, our monastery has stopped all the religious matters on the consequence of the fast infection of COVID-19. Our closure is intended to remain unchanged until the virus infection doesn't come to a stop. At a time only when we are able to overcome the virus crisis, we will resume religious affairs such as ceremonies to novitiate, being ordained, lead recitation of the precepts to be taken by laypersons. We are unhappy that the virus is taking place in our time of doing meritorious deeds. The laypersons can keep Sabbath at their houses and take the recitation of the precepts by staying at home, although they can't come to the monasteries. So we would like to urge all our laypersons to do good deeds, staying at home in an effort to prevent against the virus infection.
The monastery doesn't need to worry about the meals because they have sufficient consumer goods such as rice, edible wine, onion, and so on. But they don't have the lay persons who cook for monastery, and so the monks from the monastery are themselves taking the cooking duty, said Presiding Sayaro Badana Tumana. Some monasteries are facing insufficient provisions, but NGOs and the people are donating necessary items to them. The government has only provided basic foodstuffs to the families who have lost their incomes because of the COVID-19 pandemic during Thingyan. As supplies are intended only for the neediest, the local authority have collected the list of eligible households. Speaking to Emma Radio about her difficulties and related government food distribution, Tochutima, a shopkeeper selling bitter leaf in the downtown, said.
My husband passed away for long. I have 2 daughters and one of them has just finished her matriculation exam. I also earn some extra money from a company. Some of my relations also provide me. Every year, Thingyan is the most exciting and enjoyable celebration for us. But this year, almost all fun has gone. Before Thingyan, some businesses have temporarily stopped their operation, and only few people are passing through, even in the downtown. Our business is affected. There are no good sales, and we have faced some sort of difficulties in our living. I am living at 70 Ward in South Dagon. The administrators collected the household list to provide some foods 2 days ago. We are on the list, but we have not got yet. I am happy that the government is providing basic food items to the households which are in need.
According to Unyinyi local representative, the commuted South Constituency 1, Yangon Region government is also planning to provide rations to the squatters. Currently, there are over 400,000 squatters in Yangon. Unyinyi local representative, the commuted South Constituency 1 said.
The
public is asking how long they have been staying at home and how about their living is. Yes, we are providing food distribution. Especially there are over hundreds of thousands of squatters in Yangon. As far as I know, the Yangon region government is going to help these squatters. We can see many people are holding public donations, so we are dealing with the difficulty of the public as much as possible. We would like the people to stay at home so that it will limit the spread of infection.
This is news reporting from Myanmar Radio. I am Pyodirido.
That's a report on the COVID-19 outbreak in Myanmar and monasteries to self-quarantine to limit the spread of the virus. All right, we'll carry on with the next report. The Ministry of Health and Sports reported 12 new confirmed cases with the total number of infected patients brought to 85 in Myanmar Thursday. The increasing number of cases shows that COVID-19 is spreading very quickly in Yangon, which has a population of 7 million. In connection with the positive cases up to 85, State Councillor Aung San Suu Kyi held a video conference meeting with the civic organizations from Moon State on Wednesday. Here's a report.
The Ministry of Health and Sports reported new confirmed cases with the total number of infected patients brought to 85 in Myanmar. The increasing number of cases shows that the COVID-19 is spreading most quickly in Yangon, which has a population of 7 million. The ministry also announced that who tested positive are in good health. State Councillor Aung San Suu Kyi also held meetings via video conference with the community organizations and administration officers and other health and civic workers almost every day. On 15 April, she also held the meeting through a video conference with the civic organizations from Moon State. In the live discussion, Deputy Head of Moon State Department of Public Health, Dr. Whitmore, asked the State Councillor for the living of the health workers. She said,
community-based facility quarantine ကိုကျမတို့ကအဆင့်မြင့်ပြီးတော့စစ်ဆေးနေပါပြီ။မနေ့တနေ့ကဆိုကျမတို့35ယောက်တိပို့လိုက်ပါတယ်မေ။အခုအမေပြောပုံရဆိုလို့ရှိရင်တော့ကျမတို့
In a current situation, the health workers and their family members are very worried about the infection, especially for the health workers who are single or married, have been found to have difficulties in their living. They are the warriors who are fighting against the disease of COVID-19 in the front lines. In the state, the health workers have to live in poverty. I wonder that the government can provide the support for them.
The state councillor also answered how she would support the health workers in the difficult regions.
အားလုံးဆက်ပြီးတော့ဒီတိုင်းပြည်လူနိုင်ငံကလဲပတ်နေအောင်လုပ်ရတာပဲဟို COVID-19 ကြောင့်မလို့တခြားရန်တရားတွေရပ်မှာမဟုတ်ဘူးရပ်မရပ်သွားတဲ့အပြင်ပို့ပြီးတော့တောင်မှဟိုရုန်းကန်ရတယ်
Now is the important time for us. As we know the cases are up to more and more, we were trying to support all necessities to all the people are required. And the public health workers living is also an important thing to do. We will hold these cases systematically, especially we have to take responsibility for the needs of the health workers, such as food and their living. We were trying to do it as quickly as we can.
The state councillor also participated in online special ASEAN Summit and ASEAN +3 Summit on COVID-19. She also stressed about the fight against global pandemic within the ASEAN meeting, such as fostering collective efforts to minimize the socio-economic impacts of COVID-19 and other matters. With regard to the cases up to 85, U A Mao from Takong Saikan Township shared his feelings.
ဒီနေ့နိုင်ငံတော်အကြီးအကဲတွေညွှန်ကြားတဲ့လမ်းညွှန်ချက်နဲ့အညီဦးလေးရနေတဲ့နေထိုင်ပါတယ်စားရတောက်တာကအစကိုယ်ကိုလည်းအားရှိအောင်နေပါတယ်အသက်အရွယ်လည်းဦးလေးက80ထဲမှာ
I am about 70 years old.
I also follow the rules that the government ordered. I wear the mask when I go out. I am staying at home the present moment when the number of cases increases.
Of the 85 cases in Myanmar, there have been 4 deaths so far. The youngest is 47 years old, while the oldest is 85 years old. Most of all the suspected patients who have been under investigation are now in a stable condition, with 2 recovered already. The ministry also reported 123 new suspects are now put into quarantine. The Health Ministry urged those who have been in close contacts with the positive patients to inform the nearest health departments.
That's a report on Myanmar reporting a rise in the total number of COVID-19 cases to 85. Stay with us as we bring you more reports on Myanmar today. With the aim to contain the spread of COVID-19, the government has advised the public not to go out during the Thingyan holidays, but to stay at home. At the same time, several shops and shopping malls are also already closed, along with restaurants, but receiving only takeaway orders from the customers. But the good news is, there are some convenience stores which will be open throughout this Thingyan holidays, so that the public will not face any difficulty in getting their groceries. Williamson will tell us more.
With the fear for virus infection, many shops in Yangon are closed down, along with most of the restaurants where they have to follow the orders of providing takeaway service. However, many of the big shopping malls and mini-marts such as City Express will remain even during Thingyan holidays, which are 10 days long. But there are also some big shopping malls which are already closed down with the aim to tackle with the spread of COVID-19. Therefore, with the aim to help the public get their groceries, the City Express will remain open, although the opening time is reduced to only daytime, previously operating 24 hours in a day. So far, there is no order from the regional government as well to close down the shops, but advised to stay at home. Ujozia Win is Yangon City Development Committee Chairman for South Oglaba Township, and he spoke to my radio about the matter of shops closing down or not, and he said,
COVID-19 ထိန်းချုပ်ရေးကာကွယ်ရေးကော်မတီဆိုတာရှိပါတယ်ကျွန်တော်မြို့နယ်မှာထွေအုပ်ကနေပြီးတော့
The governmental officials, along with the general administrator of the township, have released a statement where it says the pharmacies and other 24-hour opening convenience stores must be open. This is not an order, but these stores and shops are requested not to close the shop during Thingyan holidays and hard time. We will inform all the pharmacies and convenience stores of a request.
Convenience stores have become more popular over the last few years. These stores are open round the clock, but according to the report by these convenience stores, there are far less customers at night comparing to the daytime. But they are here to show the customers that they serve them 24 hours a day. The customer can come and buy groceries anytime they want to. Go-Counter Joy is the leader among the staff at City Express in Babedan Township, and he spoke to my radio about the situation of the shop that will be during Thingyan, and he said,
Most of the shop here, they open at 7 a.m. in the morning and they close them down at 7 p.m. in the evening. But till now, we're still opening for 24 hours in a day. But during Thingyan holidays, we will reduce the timing down to 10 a.m. opening hours, and we will close down at 9 p.m. at night, as we have been informed about the advice from the government not to go out but to stay at home. From 10th April, the shop would be open for 11 hours in a day. And for the preventative measures among the staff, we're also providing hand sanitizer and masks for the staff as well as for the customers. And some of most touched things, such as door handle and items, are being sprayed disinfectants. Masks are also being provided for the staff, and we make sure that we don't stay too close to each other, but 3 feet away.
According to the report by some of the responsible person at convenience store, there's no shortage of commodities in the stores, and transport of goods is also carried out regularly. Therefore, the public should not worry about facing grocery shortage in the store, but stay calm. This is Williamson for my radio.
Well, let's move on to the last report before we go to international news. Confirmed cases of COVID-19 have almost hit 2 million globally, with the death toll reaching 125,000, according to Johns Hopkins University. China is particularly facing the rise in the number of asymptomatic patients. Agajo has the details.
Until April 14th, China has seen 1,023 asymptomatic patients, putting pressure on the Chinese health authorities. Asymptomatic cases refer to people who are tested positive for novel coronavirus but develop no symptoms such as fever, cough, or sore throat. They are infectious and pose a risk of spreading to others. The Chinese mainland reported 46 more COVID-19 cases on Tuesday, 36 of which were imported from abroad, according to the National Health Commission. NHC also announced one more death and 57 new asymptomatic patients. The total number of the confirmed cases on the Chinese mainland stands at 82,295. The cumulative death toll is 3,342, and 1,023 asymptomatic patients are under medical observation. On the same day, the Chinese health authority said 78 patients are discharged from hospitals, bringing the total number of recovery cases to 77,816. MI Radio reached out to Ms. Huang Yue, China Radio International reporter, to probe further into how China is grappling with asymptomatic cases.
To identify asymptomatic cases of novel coronavirus disease, stricter health measures have been taken at air, sea, and land ports in China. Starting April the 1st, all tourists entering China were required to take a nucleic acid test, and various detecting methods, including antibody testing, were adopted for more effective detection. While within the country, China demanded to strengthen the nucleic acid testing of travelers living in Wuhan. Those who are set to work as teachers, medical workers, or service providers at public places after leaving Wuhan should all undergo nucleic acid testing before they go back to work.
Medical institutions are ordered to report infections to their superior disease control departments within 2 hours of asymptomatic patients. Ms. Huang Yue continued to explain.
And medical institutions are ordered to report infections to their superior disease control departments within 2 hours of asymptomatic COVID-19 carriers being found through a direct web-based system. Once verified, asymptomatic carriers will be put under concentrated medical observation for 14 days and can only be released from quarantine upon 2 consecutive negative nucleic acid test results, with a sampling interval of more than 24 hours. And for the public, people have been asked to continue to stay alert and avoid unnecessary movement. And wearing a mask is still necessary here in Wuhan and in many other cities in China.
Wuhan City, the epicenter of the coronavirus epidemic in China, has reported 0 confirmed cases of COVID-19 among symptomatic carriers in the week following the lifting of its lockdown on 8th April. According to a report, a total of 225,999 people in Wuhan were tested for coronavirus during the week, finding 130 asymptomatic cases. None of these cases have turned into confirmed cases. The city has also observed 542 people who had close contacts with the infected person and found no asymptomatic or confirmed cases among them. As the world battles COVID-19, scientists are racing to develop a vaccine. According to the World Health Organization, 70 COVID-19 vaccines are in development around the world. 3 of these potential vaccines are being tested on humans. This is Agajo reporting for Myanmar International Radio.
And that's all we have for today's reports. Let's check on some international news now. After pointing the finger at U.S. governors for 24 hours, the U.S. president now pointing the finger once again at the World Health Organization, announcing that all U.S. funding will be suspended to the world body.
As the organization's leading sponsor, the United States has a duty to insist on full accountability. One of the most dangerous and costly decisions from the WHO was its disastrous decision to oppose travel restrictions from China and other nations.
That statement cannot stand. And it's not only violative of the Constitution, it's violative to the very concept of democracy. I mean, this was the first battle. Do we want a king or do we want a president? And we opted for a president. So that statement cannot stand, period.
The US president wants to reopen the US economy quickly. He's talked about May 1st as a possible date, one that his leading COVID-19 health advisor says is unlikely.
I think if we are assuming that 2 weeks from now, that all the curves are going to be down, I think that's a bit overly optimistic.
The head of the World Health Organization said on Wednesday that he regretted President Trump's decision to pull funding for the agency and called for world unity to fight the new coronavirus pandemic. US President Donald Trump's move to halt funding to the WHO over its handling of the pandemic prompted condemnation on Wednesday from world leaders as recorded global infections passed the 2 million mark.
The United States of America has been a long-standing and generous friend to WHO, and we hope it will continue to be so. We regret the decision of the President of the United States to order a hold in funding to the World Health Organization. With support from the people and government of the United States, WHO works to improve the health of many of the world's poorest and most vulnerable people. WHO is not only fighting COVID-19, we're also working to address polio, measles, malaria, Ebola, HIV, tuberculosis, malnutrition, cancer, diabetes, mental health, and many other diseases and conditions.
As people up and down the land grapple with online meetings, entertainment streaming, and homeschooling, telecoms companies have reported a surge in internet use. Now, Huawei says the demands of life during the coronavirus pandemic shows how essential it is to keep telecoms equipment running at top speeds.
At the moment, we're all focused on ensuring what we have in place is working for our communities. 5G is the next generation, and whilst we haven't completely put that on hold, it's still rolling out. Our priority is right now to make sure that the existing networks are running well and secure and fulfilling the roles that they're supposed to be, which is keeping people connected.
In spite of pressure from the United States in particular, the UK government approved a limited role for Huawei in plans to build its 5G infrastructure. In an open letter, Huawei urged the UK not to make a U-turn on the decision to include it in 5G plans.
We were 3 weeks into the crisis and the lockdown, and we felt it was right for us to communicate our thoughts and our contribution to the crisis, which is making sure that our own staff are safe. Many of them are working at home, like myself here in West Dorset, but many others are part of the critical engineering resource for the UK and essential workers, keeping the communications infrastructure alive. So, no, we think it's very important that we say what we're doing and what support we're giving.
In an exclusive interview with CGTN, Zhong Nanshen, China's top respiratory expert, said it's the right decision for China to order testing and quarantine for all who enter the country from abroad, no matter whether they are foreign or Chinese, describing the effort as, quote, one world, one fight. Take a look at the video for more.
It's necessary for that. So although it caused some inconvenience for the individual, for the whole country, it's good, it's correct. So that's why we are now quite stable, under control. However, outside China, now still going up. So we should pay more attention for the foreigners who are coming to China, and also to make some checkup and see whether they have infected with COVID-19, although they are not asymptomatic. They have no symptom. As you know, this kind of disease has the so-called incubation period from 3 days to 7 days, the majority, some of them to 14 days. So we need to deal with this. So not only foreigners, the Chinese who are studying or working outside China all need to receive this checkout. So that's equal. There's no difference at all. That's one world, one fight.
Well, that's all we have for now. Thanks for joining me on Myanmar Today. I'm Henry Zin. Have a great day, everyone. Stay home, stay safe, help yourselves to help the world. I'll see you again. Goodbye.